This is a summary of the CPIC guideline for beta blockers and variation in the genes CYP2D6, ADRB1, ADRB2, ADRA2C, GRK4, and GRK5. This video will specifically discuss the gene-drug pairs which were assigned a no recommendation in the guideline. A video covering the recommendations for metoprolol can be found on the PharmGKB website and on the PharmGKB YouTube channel. This guideline was published in July 2024. CPIC assigns a no recommendation to a gene-drug pair when there is insufficient evidence, confidence, or agreement to provide a recommendation to guide clinical practice at the time of publication. Based on the evidence which was available when preparing the guideline, a no recommendation was assigned to the following gene-drug pairs: acebutolol, betaxolol, bisoprolol, carvedilol, nebivolol or propranolol, and CYP2D6, beta blockers and ADRB1, the non-selective beta blockers carvedilol, labetalol, nadolol, pindolol, propranolol, sotalol, and ADRB2, beta blockers and ADRA2C, beta blockers and GRK4, and beta blockers and GRK5. CYP2D6 is an enzyme involved in the metabolism of some beta blockers, including carvedilol and propranolol. ADRB1 and ADRB2 are the beta-1 and beta-2 adrenoreceptors which are found in cardiac tissue and are involved in the activation of sympathetic nerves. ADRB1 can be antagonized by both selective and non-selective beta blockers, while ADRB2 is antagonized by non-selective beta blockers only. ADRA2C is the alpha-2C adrenoreceptor which responds to the activation of sympathetic nerves by ADRB1 and ADRB2. GRK4 and GRK5 are enzymes known as kinases which deactivate ADRB1 and ADRB2. There is insufficient or no evidence regarding the effect of CYP2D6 variation on exposure to acebutolol, betaxolol, bisoprolol, carvedilol, nebivolol, propranolol, and/or clinical outcomes. There are conflicting data regarding variation in ADRB1 and clinical outcomes when treated with beta blockers. Additional research is required to confirm or refute an association between ADRB1 variants and clinical outcomes. There is very little evidence available regarding the effects of variants in ADRA2C, GRK4, and GRK5 and response to beta blocker treatment. Similarly, very few studies have looked at the effects of ADRB2 variants on response to treatment with non-selective beta blockers. As a result, a no recommendation has been assigned to these gene-drug pairs. This guideline has been annotated on the PharmGKB website. This includes a summary of the no recommendations and excerpts from the guideline. Remember that variation in other genes, in addition to demographic and clinical factors, including concomitant medications, can affect treatment. It remains the responsibility of the clinician to determine the best course of treatment for a patient. CPIC and PharmGKB assume no responsibility for any injury to persons or damage to persons or property arising out of or related to any use of CPIC's guideline or for any errors or omissions. The guideline itself and supplementary information are freely available at the PharmGKB and CPIC websites. You can access relevant pages using the links in the description below this video.